In these last few minutes, I'd like to give the panel an opportunity to give us one takeaway message from what you've learned from the poll, what we've discussed here today, and I'll start with Katrina.
Oh, you will. Yes. So I think what I want to highlight then is something I haven't heard us talk a lot about today, that the poll did highlight, and we've learned through our other message testing that we've been doing a lot of in the past 6 months, is that it's easy for us to talk about these issues, about opioids, about economic development and economic opportunity, and in a way that makes rural America seem like a monolith. And really what the poll highlights for us too, yet again, is that there is very diverse perspective, very diverse experience, very diverse assets and problems in different rural places across the country. And so as we think about solutions or needs and priorities, it's really important not just to look to the findings from this poll, but to connect with the local leaders working in these places, and to sit down with data. And I'll just highlight a couple of resources that might be useful in that. Is County Health Rankings provides county level data related to jobs, education opportunity, different health issues, and housing and other issues at a county level across the country. And recently we released a USA LEAP data, which provides life expectancy at birth for every census, or almost every census tract across the country. And census tract is like the neighborhood level, so it gives you much more specificity. So I would just elevate the importance of recognizing that nuance and sitting down with local leaders and local data to identify the priorities in the individual communities, and that the real importance lifted up through some of our other research in partnership with the Nork Walsh Center in building relationships and trust with folks in place, so that we're not reinforcing the narrative about division.
Thank you. David?
I want to build on that a little bit, but I think the one thing that we really need to understand, and it's really kind of in response to the poll, is that the communities we've observed really succeed are the communities that own the issues. And they understand, and they try to access the databases and those types of things. And they know that they're going to need outside help, but they aren't looking for the troops to come in. And my observation, and having worked in the state government, is states are more willing to come into the communities that figure out how to help themselves. And because they're showing that vested interest in that. And the other component of it, especially when you look at economic development and also solving some of these problems, especially in the areas that we're talking about, regional areas, we haven't really talked the agglomeration of labor markets and the synergy between communities, and even the rural-urban divide. It's really not a divide, it's a continuum. And most rural communities in this area are within commuting distance of either a micropolitan area or a metropolitan area. And they're not little islands unto themselves. And we need to get over that barrier, that psychological barrier of the community has to solve them for themselves. So we need to look at that regional approaches too, and where the communities can add value to the region.
Bob?
Well,
Not, sorry.
we talked about
Ted.
It's okay. Ted, Bob. As long as I can talk, I don't care what you call me.
The election's over, so it's okay.
Yeah.
My apologies.
So we talked about the fact that people in these areas know they need help, federal level, state level help, and local level help. And I think that's really true. And I would just point out that Ohio expanded Medicaid. 700,000 Ohioans now get access to health care because of that. And much of the treatment for people who have these addiction problems is being paid for through Medicaid. And just an example of how important that is, I visited a small 25-bed critical care hospital in Appalachia just within the last couple of weeks, and I was told that 75 to 80% of the resources coming into that hospital were Medicare and Medicaid. And so I think that's a terrific example of how state and federal governments can work together to try to help these rural areas deal with this addiction problem.
All right. Now, the real Bob.
So, surprise, when we ask people what should be done, there's a big investment, a big belief in doing something with the schools, in advanced training and technology. The real problem, and David surfaced this, what should they be training their kids for 10 years from now? And I think if we had a follow-up question, they wouldn't have an answer to that. They would say, maybe it shouldn't be truck drivers. Well, what should it be? Maybe I should be doing artificial intelligence. But if you're going to help people help themselves, they have to have some sense of what the future education. We had a significant number of people who wanted to go back and get advanced training. But I think if you ask the second question, they'd be scared that what they took would never get them anywhere. And so people are going to need advice. If you are really trying to get your local school to make sure your kids don't have to leave, what is it you'd focus on? And at one end you can have stronger liberal arts, at the other you can have STEM programs. But I was really concerned that people look at training and schools as the answer without knowing what should be in those schools. That's a takeaway for me.
That's a great point.
Yeah.
Yeah, very good.
Well, I want to thank everyone for joining us today. Thank our panel for being here. You can continue the discussion on the forum website. The chat is still going on. And that concludes our panel for today. Thank you.